Okay, let's start slowly. And if you've got your friends, maybe just send the link to them as well. They can join as well. Yeah, perfect. Let's begin, guys. Yeah. Mhm. If you've got any question, just keep putting it in the chat box, and it's there in front of me, so I'll be able to answer. Yeah. All right. So let's begin. Yeah. PLAB-able Aspire PLAB-2 UKMLA. Yeah. So blueprint we're gonna discuss. First of all, yeah, congratulations those who just passed PLAB-1. So welcome to PLAB-able Aspire PLAB-2. So what exactly we have here? Mainly, it's run by Ankur Garg, that's me, and Dr. Niklesh. So that's me, and that's Dr. Niklesh. So we do the most of the classes in Aspire here, right? So if you see most of ethics, surgical examination, that's done by me, and then SIMMAN, prescription, and all those important scenarios are usually done by Dr. Niklesh. Yeah. All right, so yeah, I'll do a bit of promotion maybe later. Let's come to the topic and let's discuss a bit about PLAB-2 introduction. Yeah. So what happened is in this exam, this is an OSCE exam, right? So objective structured, it's a clinical exam, right? So what's going to happen? You will have 16 stations in here, right? 16 station, each station is of 8 minutes. Yeah. So you have 16 different patients you are going to deal with, right? And with each patient, you're going to spend 8 minutes. Then what's going to happen? There will be a task outside. So what you have to do is you have to read that task. And once you have read that task, then you are going to go in the cubicle. That's what happens, right? So you will be getting 1.5 minutes to read that task. And then you will be going in, and in the cubicle, you'll have 8 minutes with your patient. So if I say in total, you will have 9 minutes and 30 seconds for one scenario. That's how it works. Okay. And then we have two rest station as well, because, like 9 minutes 30 seconds for one task and 16 station, it's roughly going to take 3 hours. So it's going to be difficult for us to talk for 3 hours in a row, isn't it? And 3 hours you have to talk with full concentration. So that's another challenge. So that's why you will have two rest stations as well in between. So you can relax, you can have a glass of water, you can have a cup of coffee, you can have some cookies. So that's beneficial. Yeah. So as I said, total duration of the exam is roughly 3 hours. So it's challenging. It's not going to be easy, right? So lab one is also like 3 hours, but then it's an MCQ exam. You're not talking and just using your head. But here you are, of course, using your mind, and you're talking as well. You're using your body language, your expression. So it takes a lot. It takes a lot, right? And those patients, 16 patients, they are professional actors. They're not real patients, they are actors. For example, if you're appearing in a MRCP PACES exam, you'll get real patients actually. But in this UKML exam, you do not have any real patient. All are professional actors. Yeah. So you'll have the scenarios from every possible field. You'll have from medicine, from surgery, gynae, pediatrics, psychiatry. You'll have some counseling scenarios, some ethical scenario, examination, SIMMAN, prescription. So all the scenarios are going to be there. Roughly, I can say like how many scenarios comes from each department. Again, it's not given to us by the GMC, but it is just what we have observed in the last few years, what kind of stations they usually give. They usually give one prescription, they give one SIMMAN, they give roughly 2 to 3 examination mannequin or teaching station. They give 3 ethical scenario, 3 counseling scenario, and then roughly 6 scenario from history. So maybe 2 from medicine, 1 from surgery, 1 gynae, 1 pediatrics, 1 psychiatry. So that's how it makes it 16 scenarios. It's a mix of all the kinds of scenarios. So that's really good about this exam. And after COVID, when they started the exams, it was not that possible to have the exams in person. So what they started doing, tele and video consultations as well. So in the exam now, you will get 1 to 2 tele or video consultations. Tele, I mean, the patient is not going to be there in person. The patient is going to be there maybe at his home, and you're just talking to the patient over the phone, right? So that's can be there. After COVID, when they started the exam, I mean, they used to have so many tele-video consultations, but now they have got limited. I mean, 1 or maybe 2. And teleconsultation can be any scenario. It could be history, it could be counseling, it could be ethical scenario as well. Definitely, it's not going to be from examination and all, but anything else, it can be in teleconsultation. All right, so that's how it works. The exam, how it's marked, I'll go quickly over here. So they mark the exam in three categories. Number one is your data gathering, number two is your clinical management, and number three is your IPS, interpersonal skills. How are you talking to the patient? Yeah. So three things. Each domain, the maximum score is 4. Maximum score is 4, 4, 4. So each station is of 12 marks. Each station is of 12 marks, and you have got 16 stations, right? So that's how it works. So they will give you the result. For example, station number 1, you got data gathering 4 marks, you got 1 in clinical management, you got 4 in interpersonal. In total, you got 9. What was the pass score required? Maybe 7. So you passed the station. So this is how you are gonna get your result, right? So this is the sheet you are gonna get. Fine. Now, to pass this exam, what else you have to do? They are marking us actually on these 10 skill areas. They are checking us on how is our consultation skills, how are we making the diagnosis, are we able to make the diagnosis, or are we giving differentials? If you're doing the examination, are we able to do it properly? Are we able to use the instrument proficiently or not? If there are findings given to you in the history, in the examination, in the investigation, are you able to interpret it accordingly? Patient has got the issues, are you able to manage the issues properly or not? So they are marking us on these criteria: language, listening, management, rapport, and time. So they're marking us on these 10 skill areas. Okay. So this is how it's gonna work. And in the exam, another strange thing is you will not be having any watch, and you're not allowed, you won't be allowed any watch, and there won't be any clock in the room as well. So what happened is, you have got 8 minutes with your patient. Then how will you have a bit of idea, like now, how much time is left? So that's a bit of challenge. So what happened is, as you don't have the watch, there is no clock in the room as well. So what happened is, there is a bell system actually. There is a bell system. After 6 minutes, there will be a bell saying 2 minutes left. There's a bell saying 2 minutes left. And then there is a bell saying, move on to the next station. So this is how it works. So that's the bell that is going to give you idea about the time, right? Now, let's quickly discuss about these feedback statements. I mean, what exactly they are expecting from us in this, right? Any doubt, anything, just keep checking, keep putting it in the chat box. Yeah. I hope you're going with the proper speed. I mean, if you want me to slow down or go quickly, let me know. Yeah, are we good? Okay, perfect. Right, so first is consultation. So what exactly they're expecting? So this is positive and this is negative. So this is what you should do. This is definitely you should not do. So consultation it is a smooth consultation. So you have to do a smooth consultation, meaning you have to go in a pattern. Don't jump. And if it is unstructured consultation, if it is illogical, if it is disordered, they won't give you marks for it. So it will be considered a negative. So, when you're taking history, you have got a presenting complaint, you elaborate the presenting complaint, then you have got some associated symptoms, then you rule out some differentials as well, then you go to past medical history, then you go to lifestyle history, then you go for social history. So it's a pattern, isn't it? So if you're jumping from this pattern here and there, so they don't like it, and you might be getting a tick in consultation. Okay. Then we have got the issues, meaning recognize the issues. Obviously, the patients, when they are here, they have got some issues, yeah? So one thing I would like to ask, are you going to do medical treatment first or non-medical treatment first? Yeah. So if a patient comes, are you going to do medical treatment first or non-medical treatment first? The thing is, it depends on the patient, isn't it? So if a patient comes to you, it depends on that, like if you're doing the medical. Because if a patient is here and having acute exacerbation of asthma, so are you going to do medical treatment first or non-medical? It's medical, isn't it? You have to give the oxygen and all those things. But if it is a diabetic case or other cases, so you might be doing non-medical treatment first as well. So make sure you recognize the issue, because giving health and lifestyle advices to an acutely ill patient, it doesn't make any sense. Yeah, so that's very important. Another is time management. So you know how much time you have got. You have got in total 8 minutes. Yeah. So how are you going to divide it into data gathering and your management skills, and then IPS? IPS is how you make the patient comfortable. How are you talking to the patient? Yeah. So what you do in the time, so how much time for data gathering, how much time for management? And that's a big challenge. How much time you're going to spend for data gathering, how much time you're going to spend for management? A lot of people, they say when we have got the bell after 6 minutes, so we should be spending 6 minutes in data gathering and the last 2 minutes for management. What do you think? What do you guys think? Would it be a good idea spending 6 minutes on data gathering and then last 2 minutes for management? Tell me. It's an interactive session, so I would like you to participate maybe in the chat box. So how much time for data gathering, how much for management? You know that data gathering is of 4 marks, management is of 4 marks as well, and IPS is 4 marks. So how much time for each domain? So the thing is, we have to be very careful. I mean, I would say spend equal time. So I would advise you to spend 4 minutes for data gathering, 4 minutes for management. Yeah. Now, somebody's asking like, okay, so what about the examination? So some stations we have examination. See, you will be mentioning about the examination. In some stations, you are expected to do the examination. In some station, you will just mention, I would like to do this examination. And when you do that, you will be getting the findings from the exam. Now the challenge is, how would I know whether I'm going to do the examination in here or I'm just going to mention it? Who is going to decide it? So when you go in the cubicle, what I would advise you to do is just check the room, what they have given it to you. I mean, if there are instruments for doing the examination, if there are mannequins in the room, what does it mean? It means it's an examination station and they are expecting you to do the examination. But when, for example, you want to do abdominal examination, you want to do chest exam, heart examination. So, for those, you have to have a couch. You need a stethoscope. But when you enter in the cubicle, patient is sitting on a chair. There is no couch in the room. There is no stethoscope. So what does it mean? It means it's a station where they want you to mention about the examination and they will give you the finding. The examiner, the dear examiner is gonna give you the finding. So this is how it works actually, right? So otherwise I would say data gathering for management for, that's how you should go. The common mistake that a lot of people do is they do spend too much of time on data gathering and they're left with no time when it comes to management. So please be careful about it. Then findings, identify abnormal findings or results. Yeah. So whatever history findings, examination findings, or investigations they give you, so make sure you're able to interpret and tell it to the patient accordingly. Examination, any station they're expecting us to do the examination, so make sure you do the proper examination and use the instruments proficiently. Yeah. Now the diagnosis. What do you think? Will you be able to make the diagnosis or not? Will you be able to make the diagnosis in all the stations? The thing is, maybe yes, maybe no. So in your clinic, when you're sitting and you're not able to make the diagnosis, what do? You have your differentials with you. So what do? You investigate the patient accordingly. Right. So this is something that you have to do here as well. For example, you're taking history, you understand that there is a chest infection, but you don't know, is it pneumonia? Is it PCP? Is it TB? What kind of pneumonia it is? So you say, John, I've taken your history. What I understood is you've got cough, you've got shortness of breath, you've got fever. So it looks like you've got chest infection. Now, which bug is causing? I'm not very much sure about it. So what we have to do, we have to do further investigations for you. I'll be doing some blood tests. We'll be taking the phlegm sample and send it for investigation, and we'll be doing the chest x-ray as well. But you said you have cough, you have fever, I'll give you something for cough, I'll give you something for fever as well. So that is something that you can do. I mean, it's not wrong because that's what you do in your clinic as well. Only on the basis of history or examination. It's not like all the time I'm gonna get the diagnosis. Sometime I may be, sometime I may not be. So just simple one thing I'll summarize, just behave like a doctor in the room. That's it. Yeah. Management is you have to do proper follow-up and you need to give the warning signs as well to the patient. Yeah. Make your patient comfortable. Rapport. How are you going to make your patient comfortable? See, first of all, you have to show it to the patient somehow that I'm here for you. These 8 minutes that I'm being given, it's just dedicated to you. So you have to have that enthusiasm when you do the consultation. I've seen some candidates when they do the consultation in a very dull posture. Okay, tell me, how can I help you and all. So it's not very nice. You have to have that enthusiasm. When you have that, you have to show it to the patient. These 8 minutes are dedicated to you. If somehow you can prove that, no, it's gonna give you good score, at least in IPS, right? Another thing, how can you make your patient comfortable, I would say, is listening to the patient. Most of us, we come from a country where we have to see maybe 30 patients in an hour. So you don't spend too much of time with one patient, right? So here you'll have enough time. So make sure you develop a habit of listening, right? Listen, listen, listen. You don't get marks for talking, you get marks for good listening. Britishers, they love talking. Let them talk and listen. So listening is very, very, very important. Yeah. And in listening, remember one thing, you have to pick verbal as well as non-verbal cues as well. So what do you understand by non-verbal cue? Verbal as well as non-verbal cue. Non-verbal is patient is not telling you, but they will show you those cues. For example, patient is shaking his leg. What does it mean? Patient is not comfortable, but they're not telling you. They're not saying I'm not comfortable and all. There is something they're hiding, but they're showing with their non-verbal gestures. Anything unusual that you see, you need to acknowledge. I can see you are shaking your leg. Is everything all right with you? Do you want me to do anything for you to make you more comfortable? So something like that you need to do. Okay. Language, make sure you use the language or explanation that are relevant and understandable to the patient. Yeah, that's really important. I mean, don't use medical jargons, don't use medical words. Patient won't be able to understand. Yeah, so that's what we have to do. Yeah. How you usually start a station. So make sure you always greet them when you say hello, you always greet them with a smiley face. See, guys, there's a difference between smiling and laughing. I'm not saying that you laugh on their symptoms, right? No, just having a bit of smile shows that you are confident. You're confident and you can do what you're doing and you know what you're doing, right? So greet them with a smiley face and then you introduce yourself with full confidence. Hello, I'm Ankur, one of the doctors. May I get your name and age, please? Okay, I'm John, I'm 44. Hello, John, nice to meet you. What brings you to the hospital? How can I help you? So this is how you have to start the station. You know, first impression is the last impression. Yeah, make sure it's good. Make sure you are confident. That's what you have to do. Yeah. So how are you going to go with the history? So we go with the history taking like we have presenting complaint. We do elaborate the presenting complaint. We ask associated symptom, rule out some differentials, past, personal, social history. That's how we go, right? Let's make it a bit interesting. If you are ruling out differentials, how many differentials you think you should rule out in a history station? Answer. How many differentials you think you should be ruling out? How many differentials? 2, 3, 3, 4, 2, 3. Okay, fine. Okay, let's go a bit more into detailing. So whenever you have a presenting complaint, it can be pain, it could be cough, it could be shortness of breath. So what you do is you elaborate it. If it is pain, you have got the Socrates mnemonic. S is site, O is onset, C is character, R is radiation of the pain, associated symptoms, any time, any exacerbating and relieving factors, and severity of the pain, right? So that's what you do. And if it is not pain, but cough or shortness of breath, so you can use the mnemonic ODPARA as well. Onset of cough, duration of the cough, intensity of cough, progression of cough, any associated symptom, any relieving and exacerbating factors. So same thing you can do here as well. And if it is cough, obviously you'll ask one more question. If it is productive or if it is dry. And what's the color of the phlegm? If there is any blood in the phlegm. So these are the questions that you're gonna ask. If the station says it's fit for loss of consciousness, dizziness, vertigo, then how are you going to take history? So you're going to take history and before, during, after. Before, during, after. Right? So this is how it's going to work. Yeah. So how many differentials we should rule out? Let's see. And this I'll explain. So how you start the station, you introduce yourself, you identify your patient, and then you start like, how can I help you? So how can I help you is a very open question. So patient said, I'm in pain. So what you do, you need to elaborate the pain. Always make sure you ask open questions. Sometimes when patient says, I'm in pain, and we tend to say, doctor, okay, tell me, where is the pain? For how long you have pain? Don't do that. What you're supposed to do is tell me more about it. Tell me more about it. Always open question. So patient will tell you something about their pain. Whatever they have not told you, you can elaborate it by doing close questionnaire as well. Right? And what you do, you have to fulfill your Socrates and Odipara. That's how it is done. Now, how many differentials I'm gonna rule out? Okay, so we will come into it. So what you did elaborate the presenting complaint. Once you are done with the elaboration of presenting complaint, you ask the patient, do you have any other symptom? Again, I'm asking an open question only. So is there any other symptom? If patient says, yes, I've got another symptom like say cough, what you do, you elaborate the cough as well. So you have got pain, you have got cough. Is there anything else? That's what you do, right? Once you're done with it, you have got elaboration of one symptom or two symptoms. So you have some differentials in your mind, isn't it? So what you can do, you can ask some associated symptoms to make your diagnosis, and you will rule out some differentials which you have not ruled out earlier. What I mean by that, when you elaborate the presenting complaint, you will be ruling out some differentials unknowingly. I'll show you an example. So you don't need to rule out those things again and again. If you did it once, it's enough. So if you elaborate the presenting complaint, you have ruled out so many differentials. I'll show you. And when you are trying to rule out more differentials, make sure you're ruling out emergency differentials, serious differentials, killer differentials. That's what you have to do, right? Uh, do rule out differentials out loud. No. It's not like that. You don't have to say that I'm ruling out this differential. No, you just ask questions. An examiner will be knowing that which differentials you're trying to rule out. Yeah, I'll show you an example. Okay, you have to help me out, all of you. So what we have got a 28-year-old female patient. She has got pain in, let's say, right iliac fossa. I would like you to give me the differentials. Please give me the differentials. I'll write here. A young female, pain in the right iliac fossa. Appendicitis. Ectopic pregnancy. PID. Fibroid is more of a dysmenorrhea, doctor, but yeah, we can see that as well. Torsion ovary. IBD, Crohn's or ulcerative, fine. Okay, abscess, ovarian or tubal abscess. Okay, so UTI, stone. All right, good. Keep going. Terminal ileal disease. Oh my God, you're killing the patients. It's a cancer, isn't it? You're trying to say cancer. So that's fine. Yeah, okay. Okay, UTI and pyelonephritis. Okay, I'll put it in this way. Yeah. Menstrual cramps. Okay, that's fine. Okay, understood. So I think these are the most common ones. Yeah. Now, ovarian cyst. Okay. Yeah, 10. I think it's enough. Yeah, renal calculus, it's there. I think stone, we have written that. Yeah. So we have got that there. All right. Got it. Now, let's do one thing. What we have to do is we have to elaborate the pain. Yeah, we have to elaborate the pain. So first question is, tell me more about pain. If I say, doctor, it started here in the right iliac fossa, and it is still here. It's a pain like 5 out of 10. And I've been taking paracetamol. It's not helping that much. The pain is still there. And yeah, it started yesterday and it is a continuous pain. Severity is 5 out of 10. Now, what I did, I didn't try to rule out any differential. What I did, I just told you the Socrates. I just elaborated the pain. Now, with this pain, I said the pain started from right iliac fossa. It is still here. Can it be appendicitis? The answer is not really. Because in appendicitis, the pain starts from umbilicus, then it go to the right iliac fossa. So it is less likely to be appendicitis. Fine. What I also said, the pain is in the right and it's not going anywhere. But what happens in the renal stone? What happens in the renal stone? Your pain, it is from loin to groin, isn't it? So that's why it is less likely to be stone. Yeah. Now, I told the pain severity is 5 out of 10. Can it be torsion ovary? I don't think so. It is not torsion ovary. Torsion ovary patient is going to come straight away to you and the pain is like kind of 10 out of 10, isn't it? That's what is going to happen. So, can it be ectopic? Maybe. Can it be PID? Maybe. Can it be IBD? Maybe. Can it be abscess? Maybe. UTI? Maybe. Menstrual cramps, ovarian cyst? Maybe. But what I did, see, if you see what I did, I just elaborated the pain. I just elaborated the presenting complaint, and I was able to rule out 3, 4 important topmost differentials. right? So that's what I'm trying to say, that when you do elaborate the presenting complaint, lots of differentials will be out of your list automatically, right? Now, once you are done with the elaboration of presenting complaint, what should be your next question? Your next question is there anything else? And my answer is, okay, so my answer may be, doctor, I been having, say, fever. I've been having fever as well. Okay, fever, and I've been taking paracetamol, so that's quite helpful. Anything else? No, doctor, that's it. So I said fever. So if I say fever, it's going more towards the infection side, isn't it? So I will ask, what other question now you think we should ask? Tell me, tell me. I asked fever, patient has got fever, patient has got pain in the right iliac fossa. What other symptom you think I should be asking now? Give me the question I should be asking. It's a young female patient. Loss of weight, maybe, but loss of weight is not that important because I'm not looking into cancer and all, because my patient is a young patient. I'm not saying it's wrong question, but maybe not required at this point of time. So maybe I can ask for, okay. So you asked me very good question. Okay, wait. So maybe we can ask for any burning sensation while passing urine. We can ask for abdominal symptoms as well. Let's start with anything. Let's start with maybe burning sensation, right? Do you have any burning sensation while passing urine? No, doctor. Okay, so less likely to be UTI. Are you going to the loo more often? No, doctor. Okay. Fever is there, but it's not there. I mean, any now it's a female patient. Any maybe vaginal discharge? Can I ask that question? Yes, doctor. I've been having greenish discharge coming. Okay, greenish discharge. What does it mean, greenish discharge? So it's going more towards the STI or PID? Yes. So what you can do, you can ask more associated symptoms to confirm your diagnosis of PID or STI. So what you can ask, maybe any redness, hotness in the private area. Yeah. What else we can ask? Maybe we can ask any ulceration in the private area, right? So these are the questions that you can ask. Yeah. Now, what do you see? It can be PID, it could, ectopic is one of our differentials, IBD you said, abscess you said, menstrual cramp and ovarian cyst. So now tell me, so what I got from the patient said, I've been having this pain, 5 out of 10, right iliac fossa, started there only, and associated symptom, I've been having fever and I've been having this vaginal discharge. And then I asked redness, hotness and ulceration, that is, yes, there, right? It looks like PID. So now what I have to do, I have to ask more associated symptom to confirm my diagnosis. So for STI, what I should be doing, I should be asking sexual history. Now, one important point we will be discussing here. See, sexual history is usually here in the personal lifestyle. I mean, this is where we ask sexual history. And now, should I ask sexual history here in the end, or should I ask it now? What do you think? Should I ask it now or should I ask it in the later part of the station? I should be asking it now, because if I don't ask it now, I will not be having the diagnosis and I don't know what the hell I'm doing in the station, isn't it? So ask it now and you got it positive, but patient has got multiple sexual partner. So what happened is you almost have made the diagnosis of PID. Now, I know you want to rule out these differentials as well. Let's rule them out. When was your last menstrual period? Doctor, 2 weeks ago. 2 weeks ago. Now tell me, can it be ectopic? The answer is no. Can it be menstrual cramps? No. So one question I ruled out two. You want to rule out IBD? Any bowel problem, any diarrhea, constipation? No. That's gone as well, isn't it? So now I'm left with ovarian cyst or maybe abscess as well. So obviously, even if it is PID, I'm definitely gonna do an ultrasound scan. I can rule out those things by doing a scan as well. Moreover, I have gotten other symptoms like multiple sexual partners, redness, hotness in the private area, greenish discharge, pain. I think it's enough to make the diagnosis of PID. So with this example, what I was trying to explain that first of all, you don't need to rule out 10 differentials. You have to rule out, as I said, 4 or 5. That's enough. But when you elaborate the presenting complaint nicely, maybe knowingly or unknowingly, you have ruled out so many differentials already. That is the main thing that you need to do in your exam. And again, you don't have to tell the examiner that I'm trying to rule out this differential, I'm trying to rule out this differential. No, you just take history and it is understood for the examiner what are you trying to do. Yeah. And then you have got past medical history. Quickly, you can ask previous similar episode, medical illness, medication, allergy, hospital stay, surgeries, family history, smoking, alcohol, diet, physical activity, stress, drugs, sexual history, travel, occupation, living condition, driving. So many questions are there, right? Is there anything else that I should know? That's very important point as well. Sometimes what happens is you have taken the history, but you might have missed something very important. And maybe you have got a very good rapport with your patient as well. So maybe when you ask this question, is there anything else I should know that might be able to help you out? Yeah. Patient's concern, and the main thing is impact of the illness on the patient's life. That's very important point. See, your aim is not to treat the patient medically only. You have to treat the patient overall. That's very important. For example, many patients say, "Oh, doctor, I've been feeling tired. It's been 6 months." Obviously, you'll manage the tiredness, but ask how this tiredness has affected you in general life. That's why for doctor, oh doctor, I used to help my kids in their homework and all, but now I just feel tired when I go home from my work. I just sleep, and it's very difficult, and I really want to spend time with them, but I can't. So this is affecting the patient psychosocially as well. So that's really important, I mean. So this is not, it's not the medical exam only. It's a medical communication, it's everything. I mean, in this exam. It's more of acting exam as well. It's a lot of things you have to do in this exam. So you said in data gathering, we'll be spending 4 minutes, right? Guys, we agreed in the beginning, 4 minutes for data gathering, 4 minutes for management. So this is your data gathering actually. This is part of the data gathering. This is your management that I'm going to discuss in a while. Yeah. So now how much time for data gathering? 4 minutes. So, this part of the data gathering, this part, you have to make the diagnosis. This part is going to give you the diagnosis. So I would advise you to spend maybe 2-3 minutes here because you have to get your diagnosis. Even if it is taking more time, it's fine. You have to spend time. There is no other alternative to that. But when it comes here in the past, personal, social history, there are like 20 questions that you need to ask. Yeah. But if you ask all 20, it's going to take again 2-3 minutes of my time. Then how and when I'm going to do the management? So what you have to do is you are not supposed to ask every single question. You are only asking the important questions. That's it, right? You always ask only the relevant questions. So from this 20 question from past, personal, social, I would advise you to ask only 4 or 5 questions. Yeah. Which one that you will decide, nobody can tell you. For example, it's lung cancer scenario. So what I'll ask maybe previous similar episode, family history, smoking, occupation. That's it. That's it. Now you might be thinking, why is leaving other question? Alcohol is important as well. Diet is important as well. Physical activity is important as well. Okay, I agree with you. It is important as well. But my answer would be management is important as well. Right? So what you have to do, you have to do the management as well. So where is time? And who's a good doctor who gives less medication? Who's a good doctor who asks less questions? So you won't get marks for asking so many questions. You will get marks for asking relevant questions. So before you ask any question to the patient, I would advise you to ask it to yourself. Why I'm asking this question? What I am going to achieve by asking this question? So if you're not able to achieve, if you think I'm not going to achieve anything, then please don't ask. That's the aim, right? After that, what you do once you're done with the history, you'll mention about examination, you'll mention about initial investigation. Examination and initial investigation. Fine. So you'll mention, like, for example, I would like to do general physical examination. I would like to check your vitals. For example, it's a case where there is a young female going to the loo more often and waking up in the night as well. She has to rush to the loo as well. So we're suspecting it's a case of UTI, for example. So what you do, I would like to do your general physical examination, vitals, and I would like to do your abdominal examination as well, or examination of your tummy. That's what you do. Fine. Which investigation? I mean, the history is kind of telling you it's UTI, but which initial investigation you should be doing? I'll be doing a routine blood test, and the main thing is I'll be doing urine dipstick. So what happened when you say about this and this, examiner will give you the findings. So the findings are patient has got tenderness in the tummy, and urine dipstick is telling us that patient has got leukocytes and nitrates positive. What does it mean? Now you have got the positive points in the history, you have got positive points in the examination investigation as well. So what you can say, oh, completing, I mean, the history that you have given me, the examination I've done the investigations as well. All these things are telling me that you might be having a condition called UTI. Then what you do, you will disclose and explain the diagnosis. Also explain the positive examination and investigation findings as well. What I mean by that. Okay, so we're suspecting you might be having UTI because you're going to the loo more often. You are waking up in the night as well. You're rushing to the loo. You are having fever as well. And then when I did the examination, I found there is tenderness in the tummy. And then when we did the investigation, we found there are certain kinds of cell leukocytes and nitrates. They're high in your urine sample. So all these things are suggestive that you might be having a condition called UTI. So that is how you have to justify things, right? What is this ICE? This is your biggest friend, I mean. This is the most important friend, I would say, in PLAB-2 exam. Idea, concern, and expectation. You know why I've written it here? Do I need to do ICE here only? Can I do anywhere else? The answer is you can do anywhere else you want. You can do more than once. You can do I here, I in the beginning, C maybe here, E here. It doesn't matter at all. It doesn't matter at all. Wherever you want, you can do it. So you can ask the patient, do you have any idea what's going on with you? Are you concerned about anything in particular? Is there anything else you are expecting from today's consultation? So these are the things that we do. So sometimes, when there is a diagnosis and it's not very clear what the diagnosis is, and when you do ICE, you ask the patient, do you have any idea what's going on? And they will give you the diagnosis. It's very surprising, but they will give you the diagnosis. How they know about the diagnosis? Because you tell me, so if you are sick, do you do Google and try to find your symptoms? I know we are doctors, we still do that. So what happens to a non-medico when they have got a couple of symptoms? They'll be putting it on Google, isn't it? Nowadays on Chat GPT, they'll put it. Okay, so what these symptoms relate to, I mean, so they will be knowing. So when you do that idea, so they might tell you, doctor, I'm just concerned about this thing, and that's my idea that I might be having cancer, I might be having multiple sclerosis, I might be having this and that. I mean, so that is quite helpful. Expectation is very, very important. I'll give you an example of expectation, because some candidate says it looks a bit awkward when we ask, what are you expecting from today's consultation? I agree, it's a bit awkward. So don't ask it like this directly. So what you can do is you can give the management and then say, is there anything else you were expecting? So that could be better. So I'll give you one very good example here. So we have a station on tension headache. Very normal common scenario, tension headache. Because of stress, patient is having headache. So what's the management of tension headache? Can I say stress management and a good lifestyle, like no smoking, no alcohol, good diet, good physical activity? That's the management. So you got a station on tension headache. You did the stress management. You did mention lifestyle advice, everything. And you're like, oh, I did really well in this station. And what happened? You got 1 mark in the management out of 4. Why? You didn't fulfill the expectation of the patient. What was the expectation? You never asked. So this patient, when you ask, okay, so we're gonna, as I mentioned that you have got tension headache, we're gonna mention it. Now we're gonna talk about the management. It's the stress management and your lifestyle. I'm gonna talk about it. But is there anything else you are expecting from today's consultation? Doctor, I was expecting a CT scan. I was expecting a CT scan. Now, do we do CT scan in a tension headache scenario? The answer is no, you don't do it. That's very common, you don't do it. But if you will not talk about CT scan, you will not get marks for it. I'm not saying you have to do it, but then you explain it to the patient that the symptom that you have got is going towards tension headache and a CT scan is not required. It's simply like, exposing yourself to the harmful radiations when you don't even need it. So that would be your explanation. So, but patient had a concern, and the Britishers, they have got some hidden agendas most of the time. And if you don't ask these ICE questions, they won't tell you also. So that's why ICE is your best test friend in your PLAB-2 exam. Okay. And then what you can do is you can talk about further investigations as well if you would like to do any. Then talk about the treatment. It's a symptomatic and the specific treatment. Talk about medical and non-medical treatment, right? And if you have to admit the patient, admit. If you have to discharge the patient, discharge. If you're not sure, make sure you involve your seniors. Yeah. Follow-up and warning signs. And you can always give leaflets, pamphlets to the patient as well, right? So this is how you have to do. So this is 4 marks also. The management is also 4 marks. Yeah. So management is not just telling everything to the patient. Management is maintaining two-way conversation. That's very important. So after saying 3-4 lines, my advice would be you keep pause. You just keep quiet for some time and then you let the patient ask questions. So that's really important. If you're just vomiting it out, everything, I'll do this, I'll do this, I'll do that, I'll give you this medication, it's not gonna give you marks. Management is two-way conversation. Management is involving the patient. Management is making the patient talk. If the patient is talking, asking questions, it means you're doing very good. If the patient is silent and not talking, please make them talk. How can I make them talk? So after giving a bit of management, I'll ask them, are you with me, John? Are you following me, John? Do you want me to repeat anything? Are we on the same page? So when you ask this question, I think they will be responding yes, no, something they will say no. And that will make it as a two-way conversation. And that's what is required. Yeah. So don't miss out on this thing. That's really, really, really important. Now, what comes under IPS? IPS is your active listening. You cannot interrupt the patient, patient can interrupt you. That's the thing. Right. So what my advice would be. So, I mean, this patient is talking, talking, and talking. So what do? You listen, you listen, you listen. And you show them active signs of listening. For example, if they're talking, they might be thinking, maybe this doctor is sleeping now. I don't know if he's paying attention to me or not. So what you can do in that case? So what you have to do is listen and you can show them active signs of listening by just nodding your head. If they're talking, all right, yes, So that's what you do. That's active signs of listening. Then one is signposting. You know, when you are moving from one part of the station to the other part of the station, I would like you to signpost. Signpost is simply giving heads up to the patient that these questions are coming. That's what signposting is. So what you do is, for example, you are going to start lifestyle history about smoking alcohol. So if you ask straight away, do you smoke? It's a bit like patient is not ready for those questions. So in those cases, you can signposting, meaning now, Albert, I'm going to ask you some questions about your lifestyle, about your smoking, your alcohol, your diet, because these are important and they might act as a risk factor in your case, right? So tell me, do you smoke? So what I did, I signposted, I gave the relevance of my questioning, and that's quite helpful. Summarizing, you can summarize the case as, if you remember, I summarized when I explained the UTI that you have got, you're going to the loo more often, you're waking up in the night as well, and you are having fever as well. We found that certain kinds of cell leukocytes and nitrates are high in your urine. It shows that you have got UTI. So that is summarizing, so that you can do. And your biggest friend, bestest friend is eyes. I mean, okay, a lot of candidates ask me one question, and I'll give you a funny answer as well. So when you're taking history, do you have this question in your mind that while taking history, I might go blank? I don't know what to ask next. I might go blank for 10, 15 seconds. Then what should I do? Do you have that doubt? And any idea, what do you think you should do if you are in that situation? You're taking history and all of a sudden you're blank. I don't know what to do. So any suggestion, what can I do in those 10, 15 minutes? How can I buy time? Any suggestion? How I can buy more time? So how can you buy more time is do eyes. That's the advice that I always give to the candidates. Do not underestimate the importance of this eyes. So you're taking history, all of a sudden you're blank. I don't know what to ask. All right, Albert, do you have any idea what's going on with you? Are you concerned about anything in particular? So maybe they have an idea, maybe they're concerned about anything, and they will give you your next questions as well. So they give you an idea, I'm just worried, is it heart attack? Is it cancer? All right, I can see you're worried. Let me ask you more questions. And then you start asking maybe cancer questions. So this is like very important. If you get blank, eyes is your best friend. Yeah. Body language, positive body language. When you sit like properly, not like, okay, tell me more about it. Don't be in a dull posture. Yeah. Involve the patient in the management. As I said, two-way conversation. Yeah. Check and check. You give the information in small chunks and you check the understanding of the patient, whether they are able to understand or not. And make sure you keep responding to the non-verbal cues as well. Yeah. Now, two important pointers like trust yourself, use small sentences. It's not an English exam. All of us have passed our English exam. So make sure you have to have trust on your language skills. Yeah. We have to worry a bit about our facial expression as well. So maybe you can practice in front of the mirror, and that helps actually. to bring best from you, right? And what you can do is you can record your consultation as well. Record your consultation and listen to it. So you will see what mistakes you're doing. You gave this answer. Can I give this answer in a better way? So that's going to be quite helpful. One thing, PLAB 2 is not about what you say. You know what to say. It's very easy. I mean, PLAB 1 you have done, the medical knowledge you have. This is not PLAB 2. PLAB 2 is not medical knowledge only. It's not what to say. You know what to say. It is how you say things. It's how you say things. This is your PLAB 2, right? So that's very important. Yeah. Be strong mentally, be confident, reassurance, trust your language skill, relaxed mind can do wonders. Remember that. See, everybody's going to be stressed, that I agree. A bit of stress is kind of good as well to bring good from you, right? But if it is too much, then it can affect your performance. So that is not good, right? So you have to be very, very careful on that, right? So that's what I have, I mean, in introduction. I hope you enjoyed it. Right. Are we going to get this PDF? Yeah, doctor, I can. I mean, I'll just ask you maybe we'll give you a link for a WhatsApp group. So maybe you can come in the WhatsApp group and then we'll be able to share this PDF. No problem at all. Right. Any question in the introduction till now? Any introduction question? Please ask. Chat box is yours. Yeah. Now I'll be doing a bit of advertisement. I'll be telling about our courses, what courses we have got and how we do actually. Right. So, first of all, I would like to say one thing. You know, we are the only academy in the whole UK who is doing live in-person classes. Most of the courses, what they do is they're kind of hybrid courses and all. But we are the only academy doing full face-to-face live classes. And all our classes are live telecasted as well. Because lots of other courses, they're running by saying it's just a recorded session and all. We do have recorded session, but we do conduct live in-person classes from the academy in the academy as well, right? So when you book our course, what you're gonna get? So you will be able to attend in-person classes. And all these classes are live telecasted as well. So you can access them online through Zoom as well, right? So for example, when you're waiting for your results, you're waiting for your visa and all, and your exam is in like 3 months' time. So you're like, how can I prepare? Can I start preparing today? Yes. You book the course, you'll be having the access of pre-recorded videos and attend our next live class. You can attend it live online. So when you come to the UK, you're actually prepared. And just to polish your consultation skills, what you can do when you come to the academy in the UK, you can attend in-person classes as well, right? And with the things, you will be getting comprehensive material as well. So you'll get the book actually. So I'll tell you what we are gonna give it to you. So this is the whole book. I mean, you'll be getting the copy like this, yeah. So and you'll be getting the e-file as well, and it's regularly updated. How often we update? Every week we update it, right? So that's the thing. So book you can get, but the PDF obviously is gonna be updated. And then what we have made these flashcards as well. It's a small booklet also we have made for your quick revision. So it has got colorful flashcard which covers every single topic. That's the thing. I mean, it's good for quick revision as well. So you can have this booklet as well, right? So that is another thing. Then you will have 2 mocks included as well. So the 2 mocks will be like a full 16 stations. The way it's going to happen in the exam, you'll get the 2 mocks in the academy. So you'll be prepared before the exam. So you know what to expect when you go in the actual exam, right? Mannequin practice. See, mannequin practice, we have got a room, a proper big room. All the mannequins are there. And what's the time of a mannequin area? It's 24/7 open. 24/7, it's open for our candidates. So those who are living in Aspire accommodation as well. So it's open for them 24/7. I don't think so there's any academy in the UK open 24/7. And I know like many of you, when you come, you have got very limited time in the UK. You may have 1 week, 10 days. So you want to spend more and more time practicing on the mannequins because that's what is important, isn't it? So that's why it's a 24/7. Those who are living in our accommodation, those are living outside, so we have got a time for them. It's 9 to 7. It's for the safety things, and also that's why 9 to 7. But those who are living in our accommodation, they'll get 24/7 access. All right. Would you be able to send the PDF on our email or must be in the WhatsApp? It's better on the WhatsApp because email, it's difficult for us to send doctor because I think there are like more than 100 people joining the webinar, so it's difficult to send the PDF. So the link is there in the chat box. You just come in the WhatsApp group and we can share you this PDF, no problem. Yeah. Simban practice, that's the post-course support. I'll tell you what is post-course support session as well in detail. Academy access area, as we said, 24/7, and we have got the WhatsApp group for every single batch, and the discussion keeps on happening in the WhatsApp groups. And you will get the chance to practice with the faculty during the class. So our class is not much of teaching, it's more of practicing. So we keep on practicing. So for example, I'll tell you, yesterday I was taking the class and I would say I practiced at least 16, 17 station in one day. So you saw like 16, 17 consultation with 16, 17 people. So you feel like, yeah, I'm kind of prepared now, isn't it? So that's how it is, right? Now, what is this post-course support sessions and all? I'll discuss that in detail. But how many days in person classes? It's 12 days, doctor. I'm going to come to that as well. I'll share you the schedule and everything. So our classes are going on and it's a big academy. So classroom is different, mock rooms are different, practice area is different, post-course support where it's happening, it's different. So it's a big, some people says, okay, when classes are going on, how are you going to do the mock? How are you going to do the post-course support session? It's different. I mean, there are different rooms. We have got, 16 mock rooms we have got, and we have got three big classrooms. We have got, a big practice room. So it keeps on happening on different areas. I mean, that's how it is, right? So in post-course support session, what happen is classes are going on separately. But if you feel like, oh, my exam is next week, I can do something else. So what you can do is there is a teaching sessions for mannequins that happens separately as well in in a group. So that is something that you can attend. And then spam session. What is this spam session? It is self-practice mock assessment of the mock. So what happens is we'll make you practice in the group. Our mock examiners are going to be there. You'll be practicing with them. You'll be practicing with others as well. Because when you come from different countries, you have a question. How I'm going to make friends? How will you get friends to practice with and all? So in spam, we facilitate that and we'll be helping you in making your practice group, and then you will become friends and you'll start practicing from that. And in spam, we'll make sure you practice at least 15 station with 15 different people. So that is what is required, isn't it? And then hands-on mannequin. So what you can do, you can be a part of these sessions as well, hands-on mannequin. So what happened in that is we'll make like four groups, small groups, say 5, 6 candidates in a group, and 45 minutes to 1 hour you'll be spending in one group, and one instructor is going to be there and they're going to be discussing about the mannequins and all, and you will be doing the mannequin, they'll be observing you, and if you're making any mistake they'll be able to correct it. And these sessions are happening every week. So this is the schedule I'm giving it for you, like last to last week. This is what happened. On 26th, this happened. 26th evening, this was happening. 27, hands-on mannequin. 28, there's a prescription writing. So every week we have got the prescription writing session happening as well. Right. So we'll be giving you two scenarios. We'll be giving you the prescription paper. We'll be giving you the BNF as well. So we'll write the prescription and then the examiners will be checking it as well. So this is a spam session. This is how it works. You're sitting in front and then you keep practicing and then you keep changing your seat as well. So you'll get to practice with different people. And this is the prescription writing session happening, if you see. Everybody is given a BNF. Everyone has got a BNF. So you will see, and what they are doing, they're just writing the prescription and then it will be checked as well. And then sim and practice that happens every week. We have got the sim man. This is the sim man. It's original, I mean, proper sim man. It's quite expensive and a lot of, I mean, I don't think so anybody has got that kind of sim man in the whole academy area. I mean, this is only, I would say, we are having this sim man. It has got all the findings, pulse, blood pressure, heart, lung sound, everything it has got. So every week the session happens and we'll be getting the chance to practice with the instructor on the real sim man. So that's how it is, right? So all the mannequins are available in the practice area, and all these sessions are happening with our course. Course is happening, but it is, I mean, with the course, it's a separate thing that you will get. And everything is included. Everything is included. Now, there are some questions that you guys have asked. So What about people, those who book Airbnb? So the timing I told you, doctor, 9 to 7. And how many days in person classes? Okay. So this is our schedule of the classes. So the next batch is from 21st April. It's going to be from till 2nd of May. So it's a 12 days course, right? 12 days course. And then next batch is from 12th May, then 2nd June, then 23rd June, so 14th July. So the dates we have given till the end of this year. That's how it is. Now, you are like, okay, so when I should attend the course, that might be your thing. You can attend maybe the next batch only. Attend this April one. So I know, okay, you are not in the UK, so attend from your country only. And when you'll come here, you can attend it again, isn't it? I'm working. What should I do? So what you can do is attend maybe 5 days in this batch, attend the next 5 days in the next batch, attend 2 days in the next batch. We don't bother about these things. If attending it once, two, three, four, 5 times, no problem. Most welcome. Most welcome. So I would advise you to attend at least 2 to 3 times. Maybe once or twice online you should attend, and then maybe at least once when you come to the UK. So it depends on your visa and everything. I mean, if you have got like 6 to 8 weeks to spend in the UK, I would advise you to attend the course again in the UK. But if you are coming for, my friend, 1 week or 10 days, then what you should do? You should have already done live online classes. You should have seen our recorded videos and take part as much as in our weekly sessions of these post-course support instead of doing in-person classes. So it's you who's going to decide. It depends on your status, your visa status, your how many days, weeks, months you're planning to spend in the UK. So all those things, it comes accordingly, right? So for example, some people say, okay, my exam is in September 16 to 30, my exam. So which batch I should attend? So I would say maybe you can start attending from June or July, right? But even if you attend it today, no problem. Start from the next batch from 21st of April, isn't it? We just finished our last batch yesterday. So it was finished yesterday. So the next batch is on the 21st. So attend it as soon as possible, right? The syllabus is increasing. So, and the access of the course, till what time you're going to have the access? Till you pass, my friend. So that's what I'm saying. Come as soon as possible, right? Attend as soon as possible. Uh, uh, uh. Okay, so how many days we run the classes? You got the answer. Does the cost cover both the PLAB-2 and accommodation? Or doctor, of course, accommodation is separate, isn't it? So it depends on what kind of room you want, how many days you're gonna spend, and that's how you have to book it. So accommodation, I'll give you the links and all. So these are the accommodation links. I'll give you in a while. Can I only do your mocks in person and how much it costs? Only mocks are not advisable, doctor, and we don't do that. If you're in the whole course, then only you can attend the mocks. Outsiders are not allowed for the mocks only. Does it cost again joining every batch? No, no, that's what I'm trying to say. It's just once. Just once you book it, and the course price, I'm going to tell you, it's £649. But if you are a subscriber of PLAB, because I know lots of candidates are attending today, they are PLAB subscriber as well. So if you are a PLAB subscriber, you are having £100 off. If you are a PLAB subscriber plus you are a group of 5, I'll give you additional £20 as well. So you will be able to book the course in £529. What are you gonna get in £529? You will be able to attend the classes in person. How many times? 1, 2, 3, 4, you decide. You will be able to attend live online session as well. How many times? 1, 2, 3, 4, you decide. You will get pre-recorded videos as well, 50 hours pre-recorded videos, right? You will have the ebook and the printed book as well. You'll have the flashcards as well. You'll have 2 mock sessions as well. And you'll have the post-course support sessions as well. You'll have the SimMan sessions. You'll have the prescription session. You'll have the spam sessions. Practice in the class with the tutor. I don't know what else. Everything will be there for you. And you just have to book it once only. That's it, right? And how much the duration of the entire course? I would say till you pass, my friend. Till you pass. That's the thing, right? So no need to worry about it. If your subscription has expired, I'll tell you what to be done. What if my subscription of PLAB has expired? Don't worry. Whatever you have got, if it is expired, it's not a problem. You were the PLAB subscriber. You must have gotten a receipt from PLAB. You just send it to us And that's what is required. And also, if you come in our WhatsApp group, we will be able to help you in making that group of 5 as well. We'll be helping you in making group of 5. So you'll be able to get this discount £529, isn't it? So just come in the WhatsApp group. The link we have already shared. I'm going to share it again, right? Is the validity of the course fee paid? Yes, you just have to pay it once. Okay, these are the frequently asked questions. Let me answer. Should I select the online or in-person batch? The thing is, you can pay for the course and then you can select. That's not at all any problem, right? Does Aspire provide accommodation? The answer is yes, we do provide the accommodation. And those who are staying in our accommodation, they have got 24/7 access to the academy premises as well. All right. It's 529 after all these discounts. Yes, doctor, it's 529 with all the discounts, right? So £100 discounts and the clubbable discount, everything. We are just clubbing them and giving you this £529, right? In-person classes, online live classes, recorded classes, mocks, practice, Simman, weekly Simman, prescription Simman, hands-on, mocks, spam, I don't know what else. I mean, everything. I mean, that's what is included. WhatsApp group is there, link is there, and I would advise you to come in the WhatsApp group. So when you come in the WhatsApp group, so we'll be able to help you in making the groups as well, right? So that's why please do come in the WhatsApp group. Yeah. Okay, what else? When I should book the accommodation? So the thing is, I would say book it as soon as possible, because if you delay, then what's going to happen? You may not have we may not have the space, isn't it? And guys, something is going on that we are offering. If you're booking the accommodation for more than 28 days, if you're booking it for more than 28 days, we are going to give you 3 days free accommodation as well. So that's the main thing. So we'll be giving you 3 days free accommodation as well. So please book it. First of all, book the course. Obviously, those who are booking our course, only they are allowed to book the accommodation. So if that is what you're planning, so please book it before 30th. So you've got like next 2 to 3 weeks only. But first the course and then the accommodation. And it's going really fast. So I would advise you to book it as soon as possible. Yeah. So if you delay it, we may not have the space for you. So just be careful on that. Yeah. And let me answer these frequently asked questions as well. I'm really constrained on my time for preparation. Is it possible to have a good preparation in 1 month using just the Aspire Academy? Of course, doctor. So do you want to tell Dr. Vinayak when is your exam? That would be easy for me to explain to you. Please tell me when is your exam. When should I book the accommodation? I would say ASAP, right? Can we give a letter when you book the accommodation and course? Yes, we can give you a course letter. We can give an accommodation letter. You can use it for your visa purposes as well. My exam is in October, November. Can I book the course now? Of course. Of course, you can book it now. So I would advise you to book it now and start preparing it. See, okay, I agree your exam is in October. So if you book in August or if you book it now, how much you're paying? Same amount. My subscription is gonna end. No, who said? Your subscription is till you pass your exam. So, nothing is gonna be happening, isn't it? So that is what I was trying to say. So book it now, book it today. That's the main thing, right? How do I buy the books? That's the question. This book. Do you have to buy? No, it's included in your course. But now, if you are in India, in Pakistan, in Dubai, in Israel, in UK, not in Blackpool, for example, and I want my book in my home, how can I do it? So yes, we can courier the book to your address as well. I mean, we are going to give you e-copy so you can print out on your own as well in your country. I mean, no problem. But if you want, we can courier this book to you as well. But you might have to pay the courier charges, but otherwise, I mean, ebook is there or we can courier it as well. So whatever you feel comfortable with. If my exam is in January 26th, can I book now? Of course. If your exam is in 26th January, no problem. You have the access to your exam. And okay, some candidates they ask me, okay, if I'm not able to pass in my first attempt, then should I pay again? No. Till you pass, you are my student. That's the thing. And of course, so even if you pass, still you're my student, right? But what I'm trying to say is you have the access of recorded videos, live classes, online classes, till you pass your exam. So even if your exam, Dr. Taiwo, if it is in January 26, book it now. Start preparing from today. I'm not saying like if your exam is in January, you start like 8 hours, 10 hours from today. No, at least half an hour, 1 hour daily. You can see the recorded videos and all, and you'll feel like, yeah, I'm actually doing something, isn't it? So you will be having better understanding, you'll be better prepared for this exam. Yeah. Course validity is only 120 days. My exam is after that. What should I do? So, when you book the course and when you see the recorded video, so we have put a number of days, 120 days for the course validity. But the thing is, it's not like the course will expire after that. What you have to do is you just have to email us and we will be able to extend it till your exam date. Because, this is how applications work. Any application, there has to be a course validity. I don't know when your exam is, isn't it? So when you book it, it might show you 4 months validity, but don't worry. You can email us, okay, this is my exam date. Can you extend it? And we can extend it till your exam date. If anyhow you're not able to pass the exam and you email us again, so I failed my exam and this is my next exam date. So we'll be giving the access till that date. That's how it is, right? Can we all in one group to avail the discounts? Yes, group buy. You can make one group. Yes, so we will help you in making the group as well. So please do come in the WhatsApp group. Add your friends as well. And all of you can come together and make a group and get the discount and book the course in £529. What else is required, right? And where I can find more details about Aspire accommodation. So these are our details. I mean, any inquiries. So this is the phone number, booking inquiries or any other inquiries. And you can email info@ankhilaspirelettings.com. Our website, www.ankhilaspirelettings.com. So you'll be able to see all the different kinds of accommodation that we have got. And you can book it accordingly, right? And book it. More than 28 days, 3 days free. Yes. Yeah. The next question that we got is, who should I contact for accommodation? So we get the answer. Is there a fee for Aspire Book? Aspire Book is free. I mean, if you book the course, it's there in the course fee. Yeah. Can I collect the Aspire Book in person if I'm living anywhere else in the UK? Yes, anytime. I mean, anytime you come and collect it. No problem. Aspire books available for download. Yes, yes. I said you can download. I mean, if you're an iPad person, I'm an iPad person. So yeah, I mean, I read the books and everything in the iPad. So if you're an iPad person, we give you ebook and that's fine. And yeah, no problem at all. Yeah. And as I said, we will be helping you in making a group of 5 as well. So you can put your names and everything in the group of 5 and then book it quickly. Yeah. How do I extend my course validity? Email. And it is done. Can doctors in the same group have different exam dates and batches? Of course. Nobody is telling you that you have to be in the same group to get the group of 5 discount. You are in any group, doesn't matter. Group of 5 together, group discount done. Right? Who do I contact for course extension or batch changes? You just have to drop an email to info@aspire2plab.com. That's it. And I can reassure you, your query will be dealt in between 12 to 24 hours only. We are quick in this, right? And then who do I contact for the mock related queries? You can write to the same info, or we have got a separate mock email, actually, mocks@aspire2plab.com. Right, so that's how it is. Because you're going to book an extra mock and all those things that we can help you out with this as well. Okay, so these are the frequently asked questions. I mean, last batch, when I did the last webinar, a lot of candidates asked me these questions. So I was like, okay, let's write them together and answer these. Yeah. Where is the Aspire Academy? Good question. Let me see if I've got anything. Okay, so I'll give you the address. The address is 281 281 287 Promenade, Blackpool. It's in the UK and the postcode is FY16AJ. That's our address. Yes. And while attending a new batch, I can again take 2 more mocks. See, what it says, 2 mocks are included. Mocks, when you should take the mock? You should take the mock before your exam. So for example, your exam is in 5 months from today. So you are not supposed to take the mock just now. You should be taking the mock 2 to 3 weeks before your exam. Right? So 2 mocks are included. Whenever you want to take, you can take. But it's advisable to take it just before your exam when you're fully prepared. Because mocks are just to check how much I'm prepared. So if you're not prepared fully, there is no point in giving the mocks. So we advise the candidates to give the mock maybe 1 or 2 or 3 weeks before the exam. That's the thing. Yeah. Okay. Another thing, there is a Aspire mega giveaways going on as well. So if you book the course, participate in this as well. We'll send the link in the WhatsApp group. So www.aspiretoclub.com/mega giveaway. So in this, what you have to do is you have to just refer this course to your friends and all. So if you do that, it will show you the leaderboard as well. At the moment, Ankit, Khalil, Fortune, Maliha, they are on number 1, 2, 3, 4. That's how it is going on. You can be a part in it, and those who gonna be on the top of the list, they will be getting something. What they will get? The first person in the list will get full PLAB2 course free of cost. So whatever you'll pay, for example, you have paid 529 and you booked the course and you participate in this and you came on the top of the board, you will get course free of cost. So we'll refund your 529 pounds to you. Who is going to be in the second position in the leaderboard will get 75% off on 529. Who is on the third will get 50% off. Fourth, you're going to get 30% off. And then we have got the fifth to 10th position. They'll be getting free recorded courses plus personalized sessions with our tutors. 11 to 40, they'll get the access of free smart course audiobooks from the academy. So these are the things that you will be getting. So what I would advise you, book the course and participate in this. Yeah. Do you have a link for the blueprint of PLAB? It's there on the GMC website, doctor. And if you come in the WhatsApp group, we can share that with you. That's not a problem. How do I get to the academy from the Manchester airport? So, doctor, you can book the cab as well. So, number one is the cab service. Uber you can book, or the train. Train station is just there in Manchester. So, from Manchester to Blackpool, there are so many direct trains. You can book that. Fine. If I fail the PLAB2 and keep studying with the academy, will I give in more mocks during my further attempts? No, doctor. I'll be honest. So what happened is, it depends. I mean, so sometimes what happens is if you fail the exam, for the mocks only you might have to pay. But again, we can give you the heavy discount on that, right? So for example, our mock pricing is 60 pounds. So if you have our previous student and you have failed it, we can give you more discount on that. Maybe we can give it to you in 40, 50 pounds as well. That's what we can do. Because for mocks, it's like we have to have mock examiners and all. So that one you may have to pay, right? But other thing like recorded sessions or the live sessions or the online sessions, or you want to participate in more of post-course support sessions, that's absolutely fine. No problem at all. Yeah. Is it 529 and 5 or 549? Okay. So, right. So let me tell you, it is 649. It's 649, but it's 649. But if you are a group of 5, 100 pounds off. If you are a PLABable subscriber, 100 pound off. But if you are both, obviously we can't give you 200, then we can give you 120 off and you can get the course in 529. That's the main thing, right? So this is what we have done for our partners, PLABable actually. So as I think most of you have attended PLABable because they actually did our promotion for this webinar. So that's the thing actually, right? So that's why we are offering these discounts. So if both the things are there, so that's the thing. So group of 5, we will help you in making it. So that shouldn't be a problem, isn't it? If you come in our WhatsApp group, it should not be a problem. Yeah. And can you go through the accommodation? Yes, doctor. So accommodation, what information you need. So these are the things, I mean, you can. And if you come in the WhatsApp group, again, we can share these details. Yeah. How many months do you advise preparation for exam? I'm not sure when I should take the exam. Okay. So my advice would be, doctor, you should have at least, we advise after the course. It is not like live live in person. Maybe online you can attend. After the course, you should have at least 8 to 12 weeks. So my advice would be roughly 3 months, 2 to 3 months, I would say if you have got, shouldn't be a problem. Yeah. Is there a vegetarian restaurant in nearby area? Or can we get any pre-made food from Tesco and put it in the microwave? So if you book our accommodation, you'll have the access of the kitchen. Kitchen is fully equipped with the refrigerator, with the microwave oven, with the something you want to cook. I mean, the gas cooker, everything will be there. And we have got the food service as well if anybody want to opt for it. So we have got food delivery happening in the lunchtime and the dinner time. The pricing is per meal, it's around 4 to 5 pounds only. And they give vegetarian food, they give non-vegetarian food as well. So if you would like, you can opt for them as well. Right. And if you stay outside, yeah, if you're staying outside, obviously you can have I mean, you will not be able to access the kitchen that is there for the Aspire residents. I mean, those who are living in our accommodation, that kitchen is for them only. No. So if you're staying outside, so you will use the kitchen there, isn't it? But if you stay in our accommodation, you'll get the access of our kitchen as well, right? And the food delivery is there. I mean, so that can be taken by anybody, no problem at all, right? What are the passing marks for every station? You know, it used to be different, but nowadays, what we have seen, doctor, nowadays, the passing score for each station is 6 actually. 6. We used to say it's different for different stations, but nowadays what we have seen, passing score for each station is this only, is 6 only. Do you recommend any other additional study material? What do you think, doctor? What should be my answer? I mean, not about recommending. I would say there is no need. But if you want to read a bit more, I would say go for NHS websites, nice CKS guidelines, or patient.info. These are the sources that you can follow, right? Because we have made our book only on these 3 resources: NHS, nice CKS, and the patient.info. So that's what we follow, right? So, yeah. Any other question? Yes, yes, yes. Tell me, tell me. Ask me anything. Yeah. Yeah. As I said, do come in the WhatsApp group, and so we can help you in making your group, isn't it? And again, my advice would be book the accommodation as well as soon as possible. Yeah. Passing score. So, doctor, again, what happened is passing score is also going to be different for different stations, right? But nowadays, as I said, it is 6. It is 6 for each station, and we have got 16 station. Yeah, that's the passing score. Yeah, for every station, yes. Out of 12, out of 12. Out of 12. I think you joined late, doctor. So we have got 3 domains. We have got data gathering, we have got management, we have got IPS. This is 4 marks, this is 4 marks, this is 4 marks. In total, 12 marks. You should be getting 6 or more than that to pass the station. That's how it works. Yeah. So passing was 89 in recent. Yeah, it is different on different days, right? So sometimes what they do is they might have to cancel one station. They might have to cancel one station. So then the passing score is going to be roughly 90. So the last few exam I saw the passing score was 666 in every station, and one station it was 5. So, and they gave you for 15 station. That's why the passing score was 89, doctor. Right? So that's roughly I'm telling. I have attempted PLAB. Okay, so what was it? I have attempted PLAB 2 once, but I couldn't make it, especially in ethics and teleconsultation. Does the book have these things covered and updated? Of course, a book has got everything. How often I update the book? I said every week I update it, every week. But obviously, the printing book might be not have those updates, isn't it? Because we print it and every 2 months it's printed. But the ebook will be updated every other week. That's how it is. And we actually give you a new booklet separately. So you will be given a booklet for the new stations, and that you can read. Every week we update that booklet, and that shouldn't be a problem. Yeah. Okay. How to buy ebook? I mean, if you are our student, you don't need to buy, my friend. You don't need to buy. Or if you want to read it, come in the WhatsApp group, I'll give you. Right, I'll give you, no problem. From my side, come in the WhatsApp group. Okay, I'll tell you one more thing. Anyone who's giving a PLAB exam, okay, anybody, and you might be thinking I'm making big statement, but that's the truth I'm telling you. Anybody, those who are, I mean, appearing for PLAB, they read Aspire notes only. You attend any other academy, fine. You will be still reading my notes only. That's what I know. And we have got the YouTube channel. Please have a look at that as well. And you attend any other academy as well, you'll be still watching my videos on YouTube for your examination and other things. That I can promise you. So if you come here, I think that is easy because you will have you will not be having any confusion, isn't it? But otherwise, even if you're joining other courses, still I'll see you on YouTube maybe, on in the recorded videos and all. So that's how it is. But yeah, how to buy, you don't need to. I'll give you, as I said, just come in the WhatsApp group. Yeah. Right. So, but we don't bother about it. Why? Because it's updated, as I said, every week. So now a lot of people say, if I get the book free of cost, why should I book your course? My friend, it's updated every week, and no other academy is doing that. They don't even update in 6 months. Leave in 1 week or so, right? The problem in Blackpool is a lack of veg restaurant. See, doctor, I mean, as somebody said, like, see, first of all, Tesco, Asda, Sainsbury, Home Bargains is there. You can have pre-made food and then you can make it, isn't it? That's number one. And you can find the grocery shops this nearby, I mean, Blackpool, so that's not a problem. Moreover, as I said, we have got the tiffin service available as well. They give both vegetarian and non-vegetarian food, both actually. So I don't think so there is any problem in Blackpool. So it shouldn't be a problem. Yeah, we will help you. I mean, we'll give you the addresses. I mean, what are the areas, I mean, nearby, isn't it? See, if you're coming from an Asian country, you will not like the food in the UK, that's for sure, because the food in our country is awesome, and food here is not that great, right? So you have to compromise a bit. But as I said, there are enough restaurants. We can give you that address and all those things, all right? And we have got the tiffin service. And the tiffin food is like a home cooked food, actually. You can taste it once, twice, and then you will be like, yeah, it's good. I liked it. And so, yeah, you can see, no problem. Yeah. And for group discount, as I said, come in the WhatsApp group. Those who are not in the WhatsApp group, yeah. And as I said, we'll be able to help you in making that group as well. Are there accommodation facility nearby or in the where is our accommodation? That's a big question. Good question. You know where it is? Same building. Basement and ground floor is the academy, and then first, second, third floor is the accommodation. So what else you need? I mean, you want to study, come down, and that's it. You don't have to go outside. Okay, tell me, guys, honestly, tell me one thing. So all of us, we are done with our graduation, obviously. Some of us, we have done the post-graduation as well. Tell me honestly, what you guys miss that you had in your medical life, medical school, while doing your MBBS. What was the thing that you used to enjoy, but now you miss that? What is anything? Just a general question I am asking, but what you guys miss? Would you like to comment in the chat box? For those of us who arrived late at a Zoom meeting, can we get the recording? Sure, doctor. We will provide you with the recording. Yes. How many days accommodation is free with the course? With the course, it's not free, doctor. If you book the accommodation for 28 days, you will get 3 days free of accommodation. That's the thing, right? Anything? Nobody wants to comment. So my question was, let me make it clear. So when you were doing your MBBS, your medical school, uh, you enjoyed, I hope you enjoyed doing medicine, your 5, 6 years of your life. What was the most important thing for you? What was the thing that you enjoyed the most in those 5, 6 years? Hostel life and company of colleagues. That was the answer actually I was looking for, doctor. So, what you will get here when you will come, you will be able to live that life again. That's what I can say, right? I mean, people who has stayed in this Aspire house, I mean Aspire building. That's the feedback they give. That I lived that hostel life, 6 years ago, and I was like, I'm living it again and really enjoyed staying here. See, I'm not saying that my accommodation is 5 star. I hope, I don't know, I think your hostel also not 5 star, but the company make it 5 star, isn't it? The company of the colleagues, that's making it like 5 star. So my accommodation is 2 star. I won't say that 5 star and all. But what is gonna be that you're gonna get? Number one, it's the same building. You will be able to live that hostel life. You are cooking. You will be given all the cooking facilities and all. You can cook. While cooking, people are practicing. Can you believe? One is cutting, one is just, uh, making the food, and then they're practicing. When I see that, it looks like really nice, isn't it? So, you gave me the best answer, Dr. Priyanshi Gupta. Hostel life and company of colleague. If you want to relive that life, come. Right? What are the charges per days or accommodation, please? Or is it sharing basis? So, doctor, we have got the sharing room as well. Like in what happens in your hostel? I think most rooms are sharing, right? But obviously now you have grown a bit. So we have got the sharing room as well, and we have got the personal, like private room as well. If you want to live on your own in your room, that's fine. Because see, you will go in your room just to sleep because the rest of the day, rest of the time, you're just practicing, isn't it? You're just practicing, practicing, practicing. That's the main thing that you do, isn't it? So, I mean, you have to spend more time in the practice area only. In the room, you're just going to go to sleep, isn't it? Yeah. What are the charges? The charges are different. I mean, as you want a single room, you want a sharing room, what kind of room you want. And you know where our academy is located? It's on the promenade, on the beach. So there are some sea view rooms as well. So if you want those facilities, oh, I want sea room. So you may have to pay a couple of pounds extra as well, right? So it starts from 20 pounds and it goes till 32 pounds per night. So you can have like what you want. You can just check on the website. Our website for accommodation is where it is. It's this one, Doctor. www.ankleaspirelettings.com. Yeah. How many stations ought to be passed? So now the GMC, according to the new guidelines, they have not made it clear how many stations you're supposed to pass. So number one, you have to get above the average score. Average score is roughly around 95, 96 nowadays. So you have to get more than that. And before that, they used to say like you have to pass 10 out of 16 stations. But now that kind of criteria is not there. So what they are saying, you have to be honest, what I've seen, if you pass 10 station, you manage to pass the exam roughly. Yeah. Can you suggest how do I start my PLAB journey as I'm in the UK right now? So, doctor, what I would say, book the course and start with our online session, online live session. So, what is this session? This is online live session. So, we do that every time from the academy. So, our next course is starting from the next Monday, not this Monday, next Monday, from 21st of April. Join that course and you will be able to understand everything, right? Can we suggest how? Okay. Can we give the course fee of 529 in installments? It's a bit tricky, doctor, but if there is any financial difficulty and all, we may be able to help you out in that as well. If there are a couple of candidates, yeah, sure. Email us and we'll see what we can do for you. Yeah, please email. Yeah. Okay, so yeah, how will the exam day conducted in all 18 stations? Do we take history and examination? So on exam day, so Doctor, I've explained actually, I'll share this PDF as well. So I think, or this recording of this session, I'll be giving it to you. So I think you can have a look at it again because the exam has got 16 stations. And it has got all the scenarios from like history, counseling, ethics, examinations. It has got everything actually, right? So don't worry, the recording of this session will be given to you so you can have a look. Yeah. What else? Is mandatory to have OET validity while giving PLAB2? No, doctor. You don't need that. No. But once you pass PLAB2, if you get your registration within 3 months, they will not ask you to do OET again. Otherwise, if it is expired, then you might have to give. But answering your question, it's not mandatory to have OET validity while giving PLAB2. Okay. In how many days do we get PLAB2 results? Nowadays, doctor, it's 3 weeks roughly. 3 weeks, and you will be able to get the results. 3 weeks. Okay. More questions? Questions? Any question? So tell me, when are you booking the course? Huh? Anybody from Turkey? Anybody from Turkey here? What are the accommodation charges, doctor? It depends on what kind of room you're looking for. Is it single room, double room, sea view room? So it starts from 20 pounds till 30 pounds. So you can check the website and yeah. Single room. So single room, it starts from I think 23 pounds. I'm not sure, 23 or 24 pounds per night it starts, right? And also single room, you want single bed or double bed. So that's also the thing. I mean, so we have kept, I think, 2 pounds or 1 pound gap in that as well. So I think 24, 23, 20, roughly, yeah. So if you check the website, and you'll be able to check it in detail. This ankleaspirelettings.com. Yeah. 6 passing mark for each station, but we need 90 plus score to pass, means every station should be marked 9 marks at least out of 12. No. How many stations we have, Doctor? Dr. Pyle, how many stations we have got? I said 16, not 12. I've got 16 stations, 16. And what happened is, so you have got 16 station, roughly 6 is the passing score. So it's gonna be 96 is the passing score. Roughly, I'm saying it keeps on changing. Sometimes what they do, they might have to cancel one station. Then you will be marked for 15 station only. So the passing score is roughly gonna be 90 in that case, right? So last exam result when I saw the result was for 15 station and the passing was 89 actually. For every station the passing was 666, but for one station the passing was 5. So that's how they come up to the number of 18. Okay. Right. Any question? And yeah, so come in the WhatsApp group, as I said, and okay, there are already many candidates have paid. Good. Okay, so any other question, guys? Still 50 candidates are there. I mean, any question, please ask. Any doubt if you've got regarding the course, I'll be able to answer it now. Yeah. Or if you come in the WhatsApp group, so we will be able to help you out through the group as well. Yeah. Okay. WhatsApp group link is just there, doctor. Yeah. Or you can scan this QR code that I'm showing it to you on the screen. Yeah. Anything else, guys? Any other question? Please feel free to ask.